Protruding ears are a condition that is not uncommon in Caucasians. In fact, about 5% of patients have ears that are too prominent at the superior pole, or the bowl of the ear is too prominent. This is actually a genetic condition with what we call an autosomal recessive with variable penetrance. That's a lot of words to say that if one person in your family has had protruding ears, there's about a 50% chance that you'll have the gene for it, but there's only some chance of that you'll actually express the gene and have protruding ears. Now, some people think that protruding ears aren't very important, and in fact in Asian cultures it's often felt that it implies great opportunity, even great wealth, great fortune. And so most Asians don't usually correct protruding ears. But we know that in Caucasians there's a 40% incidence of patients with protruding ears having behavior problems or school problems. And so oftentimes we'll see children at a younger age, even age 5 or 6, when protruding ears can be corrected. They can be surgically operated on at that time because the ear is almost its adult size by then, and that's the age when children start getting teased and bullied. And today we all know how serious an issue that can be. I still see many patients well into adulthood who come to have their protruding ears corrected, and they still relate that sense of anxiety and insecurity and concern, remembering being teased and bullied when they were children. So otoplasty, or the operation to set back the protruding ears, is a very nice and fairly straightforward procedure. It can be done under local anesthesia, or it can be done under general anesthesia. It's a day surgical procedure. Sometimes we can just place sutures without making an incision behind the ear. Other times we make a small incision behind the ear, remove some of the tissue that's holding the ear away from the head, and again place some fine sutures to create a nice fold where the ear is protruding. A bandage is worn for a few days and then it's taken off. A little tennis band type of dressing is worn, something you can wear out in public for another couple of weeks or so, just to help hold the ears in place. There's a little bit of bruising and swelling, usually no or very, very minimal pain with this, and we can get a satisfying result in the vast majority of patients. So if you or someone you know well, or perhaps your child, is having concerns about protruding ears, then this is something that you may like to check out, because you can get a tremendous improvement and really help diminish a source of anxiety, a source of teasing and bullying for a young child, and even improve the well-being of someone well into adulthood.